This lecture will take a short look at a couple of different types of neurotoxic infectious conditions. First type of bacterial neurotoxin that we're going to talk about is botulism. Botulism actually paralyzes the nerves so that the muscles cannot contract. This happens when the neurotoxin enters the nerve cells and eventually interferes with the release of acetylcholine so that the nerve cannot stimulate the muscles to contract. It's a rare but serious type, usually of food poisoning, and the most common cause for botulism to develop is actually from improperly sterilized home canned food. It can also come from unpasteurized milk, honey, or cured pork or ham, and raw fish. Another type of botulism is wound botulism, and it's also on the rise due to IV drug abuse. Symptoms of botulism occur within about 72 hours of ingestion of the toxin. Its main symptoms are that it causes acute flaccid paralysis, and it can progress quickly from descending paralysis to difficulty swallowing, seizures, and respiratory muscle weakness as well. Patients also usually experience nausea and vomiting, double vision, bilateral ptosis, and slurred speech. The treatment for botulism is supportive only. There is no medication really to give. There is no vaccine. Most patients with botulism primarily need supportive care through mechanical ventilation. The only treatment that can be given is an antitoxin, and this will only stop any additional damage. Antitoxins can't do anything to reverse or treat any of the symptoms that have occurred or any of the nerve damage that has been done. It can only stop additional damage from happening. Prevention is something that is part of a treatment plan as well. Prevention looks at teaching proper canning. It can take months for the patient who's been exposed to botulism to recover, and many may never fully recover. Our other bacterial neurotoxin is tetanus. Tetanus attacks the nerves differently than botulism does, whereas botulism, as I said, paralyzes the nerves and causes the muscles to be unable to contract. Tetanus interferes with the nerves that control muscle movement, causing the muscles to stiffen. Exposure to tetanus primarily occurs from the infection being able to enter the body through a wound that is exposed to contaminated material. Tetanus actually lives in the dirt, so most of the time it's not necessarily if someone steps on a rusty nail, we say that they're going to, they have the risk for exposure to tetanus, and it's not necessarily the nail that's causing the tetanus, but it's that the nail was in dirt that was contaminated with tetanus. And it's not the nail that's creating the wound that's causing the tetanus either. Tetanus can easily get into a wound created in a sterile condition if it's exposed to the right environment. Tetanus is rare here in the United States because we do have a vaccination. If someone does acquire tetanus, the incubation period for this disease process is about 7 to 10 days. The symptoms that patients with tetanus experience are usually painful muscle contractions, stiffness in the neck and jaw, and the stiffness can lead to difficulty with breathing, and in severe forms, tetanus can lead to seizures as well. Treatment for tetanus also primarily includes the likelihood of mechanical ventilation to maintain oxygenation of the patient. They'll also follow usually a 10 to 14-day course of either penicillin, tetracycline, or doxycycline, so some type of antibiotic. They will be administered an antitoxin as well, but just like the antitoxin administration with botulism, this is only going to prevent further damage to the nerves. It cannot do anything to correct or treat the damage that has already been done. Recovery from tetanus can also take several months as it requires new nerve endings to grow. And obviously, with tetanus, one of our treatment plans here is also going to be prevention. Prevention with tetanus is going to look at, safety practices, protecting yourself against exposure, potential exposures, and vaccination. Vaccination consists of the DTaP, which is administered to children at the ages of 2 months, 4 months, 6 months, and then again between 15 and 18 months and 4 to 6 years of age. And then the Tdap, that's done between 11 and 12 years of age. And then there's the TD, or the tetanus booster, that should be done every 10 years thereafter, or after an injury if their last tetanus shot was unknown.